Sustainability and resilience of healthcare systems. Let me introduce our speakers. Mikhail Murashko, Minister of Health of the Russian Federation. Henri Kluge, Head of the European Office of WHO. Venkatesh Varma, Ambassador of the Republic of India to the Russian Federation. George Wharton, Professor of the London School of Economics. He'll speak to us online. Guzel Ulumbekova, Head of the Higher School of Healthcare Management. Matthias Schepp, Chairman of the German-Russian Chamber of Commerce. Asgar Rangoonwala, Managing Director for Developing Markets, Europe, Middle East and Africa of Johnson & Johnson. Mr. Rangoonwala will join us online. Peter Goldschmidt, Chief Executive Director of STADA. After a year of the pandemic, experts are prepared to say that the year 2020 was a breaking point. It was challenging, but it opened up new opportunities. The global community saw new horizons open up. We can now see how healthcare systems are to be transformed and what technologies will be employed to do that. Although we're still fighting the virus and victory, though not yet here yet, is coming, and we're optimistic. The greatest minds of medical thinkers are wondering how healthcare systems can be made resilient, and the same about economic systems. How can we stand up to such crises and make our resistance to them stronger? The Global Economic Forum, together with AstraZeneca and the London School of Economics, launched a survey in mid-2020 to single out the main resilience features of healthcare systems. The survey covered 8 countries, and the parameters identified are now the foundation of a resilience-building program for healthcare systems. Let me give the floor to George Wharton of the London School of Economics. He will speak about the outcomes of the survey and tell us about the answers to the questions of healthcare systems resilience that they found. George, not long ago, you conducted a global survey on the resilience of healthcare systems. What are some of the global characteristics of resilience that are relevant to all countries? George, it's over to you. George, can you hear us?
And yes, I can hear you. Can you hear me?
Да, мы вас слышим, видим.
Yes, we can hear you well. Go ahead.
Okay, very good. Thank you, Dr. Aksenova, for the welcome. It's a great honor to be invited to speak, but I must give apologies on behalf of Professor Alistair Maguire, the head of the Department of Health Policy at LSE, who was unfortunately unable to make it and asked me to stand in for him. So as Dr. Aksenova has mentioned, the London School of Economics has, over the past year or so, been working alongside AstraZeneca and the World Economic Forum on a new initiative to try to establish means of identifying how we can strengthen health systems in terms of both their resilience and their sustainability. The objective of the Partnership for Health System Sustainability and Resilience is threefold. So on the one hand, we want to build knowledge, understanding, and consensus on what it means for a health system to be sustainable and resilient. We want to use this to guide action generating evidence-informed solutions and policy recommendations. And finally, we want to facilitate cross-border and cross-sectoral collaboration, enabling international knowledge exchange. Now, the initiative has just come to the end of its pilot phase. And as Dr. Aksenova mentioned, in the pilot phase, our purpose was to establish a means of measuring or rather understanding sustainability and resilience in different national contexts. So we worked alongside research teams in 8 countries, 6 of which were in Europe. So we had teams working in the UK, Italy, France, Germany, Spain, and Poland, as well as Russia, and also Vietnam. And working with these research teams, we firstly built up a framework. So if you're going to understand sustainability and resilience, one of the first things you need to do is have a clear definition for what they actually mean and what the dimensions of them are. And having a common language, I think, will be quite useful in this regard. So the definitions that we developed for sustainability and resilience are as follows. So for sustainability, we defined this as a health system's ability to continually deliver the key health system functions of providing health services, generating resources, financing and stewardship, incorporating the principles of fair financing, equity and access, and efficiency of care in pursuit of the goals of improved population health and responsiveness to populations. So quite an all-encompassing definition there. And the key element of that is that it's about continuity and adaptability. On the other hand, we defined resilience. So resilience we defined as the health system's ability to absorb, adapt to, learn, and recover from crises. These could be born of either short-term shocks or longer-term accumulated stresses in order to minimize their negative impact on population health and the disruption caused to health services. And the reason that we didn't just look at sustainability or just look at resilience is that we think that they're both vital. Resilience has become something of a buzzword, I think, during the last year. And obviously, it's vital that we better prepare ourselves to respond to major shocks such as COVID-19. But we can't pursue that without pursuing in tandem the longer term improvements that we need to build health systems that are capable of delivering on the population's needs. So as I mentioned, having developed our definitions, we built a framework. And this was really a tool to guide the research teams in undertaking research in their countries. And it's a qualitative framework. We haven't yet got to the stage of having a robust quantitative methodology for measuring resilience or sustainability, but that is something that we do want to move forward to. In the first instance, the framework is a set of qualitative lines of inquiry that the research teams have used. And as I mentioned, we're coming to the end of the pilot phase. The outputs of the pilot phase are the series of 8 country reports. Dr. Aksenova, who led a brilliant team at the Moscow Institute for Healthcare and Medical Management, led on the production of the Russia report. And what we see in those reports are really rich, nuanced findings. What we don't find in those reports is a clear answer to the question, what makes a given health system resilient or sustainable? Because every health system is unique. They're incredibly complex, and it's very difficult to put your finger on 1, 2, or 3 characteristics that all health systems should have because of their diversity, which is partly why we opted for the qualitative approach that we did. That said, our framework consists of 5 domains. So we looked at health system governance, we looked at financing, we looked at the health workforce, we looked at the use of medicines and technologies, and also we looked at health service delivery. And so by breaking the health system down into these independent domains, which are very closely related to the World Health Organization's building blocks of health systems, we were able to examine them in various respects. It's important to note some limitations. Health systems do not exist in isolation from the wider economy and the society that they're a part of. That has been demonstrated never more powerfully than over the last since January 2020 and the COVID pandemic. And so we're looking specifically at the features of the health systems themselves. And what we found, I think, might not surprise the people that are listening to this, and that's that generally health systems have been characterized by a lack of preparedness. There's a trend towards underinvestment. Health systems tend to be seen as a cost center rather than an investment, which will deliver significant returns on investment, not just in terms of population health, but also in terms of economic output and wider measures of well-being. So we've seen a lack of preparedness. We've seen an underinvestment. We've also seen challenges in terms of developing the workforce. A majority of the countries we looked at have acute workforce shortages in some areas and chronic workforce shortages in others. When it comes to the medicines and technologies domain, we've seen some incredible developments over the last year that really underline how resilient we are. So not least the successful rollout of vaccines, albeit much more needs to be done to secure global vaccine equity. The use of technologies such as teleconsultations, remote consultations really helped to alleviate capacity constraints during the pandemic. And then when it comes to service delivery, what makes a system resilient? Well, that could be, extensive critical care capacity in dealing with a crisis like COVID. But on the other hand, for health systems to be sustainable, they also need to be somewhat efficient. So there's a very difficult balance to strike, a complex balance to strike. And it's important to note that what makes a health system resilient to crises might not always be the same thing that makes it sustainable in the longer term. And then underpinning all of this, I think, are the two most important things. So on the one hand, we have information. Information is absolutely critical to coordinating crisis response and to organizing efficient, high-quality care delivery in what we might call normal times. So information is critical, learning is critical, and ultimately it will be the health system's system of governance, how it is able to coordinate across the multiple layers and sectors of the health system, and indeed across national boundaries via institutions such as the World Health Organization that will ultimately dictate their resilience and indeed their longer term sustainability. So I think I was given 10 minutes to talk. I hope I haven't rambled too much. And of course, I'd be very happy to answer questions. But just to note that we've concluded the pilot phase of PHSSR. We consider it to have been a success, and we're currently working towards the second phase. And in the second phase, we want to develop our methodology to a much greater degree, extend the framework, develop quantitative indicators and metrics for resilience and sustainability. We want to bring additional partners on board beyond the initial three, and we want to bring it to new countries as well. In addition to continuing the partnership work that we've been undertaking with institutions such as the Moscow Institute and Dr. Aksenova's team. So please keep an eye out for announcements on PHSSR's future. This will be forthcoming very shortly, and thank you very much for listening.
Спасибо, Джордж.
Thank you very much, George. Thank you for your kind words and appreciation of our input into the project. You have shared a very important thought that information is critical in order to efficiently coordinate the response measures. Everything is interconnected in the world. No one can be fully safe unless everyone is safe. So this is a quote which we can hear from World Health Organization and other institutions. The pursuit of sustainability and resilience for the national healthcare systems is top priority for WHO. WHO is doing its best in order to accumulate the reliable and accurate information in order to provide for an enormous scope of dissemination of this information. So my next question is to Henri Kluge, Regional Director for Europe, World Health Organization. The question is the following, Henrik. How is the world withstanding the stress test of COVID-19? So what would be your comments on that? Thank you, esteemed Minister Murashko. Dear friends, I've been talking Russian for the whole day. Michael Reckenmann, the leading theater of the Russian Federation, says that the language is what connects us. I'm going to turn to English.
Invitation. This is a topic very close to my heart. Before I became region director, I was director of health systems. So I would like to point out 3 points. The first one, how do we make an economy resilient? The best way to have a resilient economy is to invest in the health of the people and the health systems. We saw something that we know for a long time, but Minister of Finance, heads of state were surprised that without health, there is no society. Without health, there is no economy, no social cohesion, even not security. The question is then how to make our health systems resilient. 3 points. First, we need the support from outside the health system because we cannot do it alone. We saw this in the pandemic. Countries which very quickly closed the borders and made some broad policies did better. That's why I created 7 months ago the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics. It is chaired by Professor Mario Monti, previous Prime Minister and Minister of Finance in Italy, and it has 18 high-level commissioners to see how can other sectors help for the health system to thrive. I just had a discussion with the Russian commissioner, Mr. Igor Shuvalov, on this one. I would like to thank Dr. Murashko for recommending Mr. Shuvalov. And one recommendation already is that we need structures for collaboration in the pan-European region. A pan-European health threat council, because we saw that Italy was closing the borders with China, there was no cohesion. Then now we see with vaccine, we need a forum to talk to each other during war times. Second, on the health system. I will not go comprehensively. I think John made very good points. But what I would like to point out is we need what we discussed with Dr. Murashko yesterday, the whole day, drug security. The Europe was very vulnerable, even for masks. For simple drugs, we were dependent from countries outside of the pan-European region. So we need to become more self-sufficient. Then to strengthen primary health care with very close link with public health and prevention. Because COVID or not, 9 out of 10 people still die from non-communicable diseases. The Russian Federation has done an amazing job on many of those, including on tobacco. I handed to Minister Murashko today from the Director General, Dr. Tedros, the World No Tobacco Award for great progress, same for alcohol. In the Russian Federation now, the person drinks less than in France, than in Spain, because of taxation, because of limitations on marketing. So we need to give responsibility to the people to create a culture of health. And that will unload our health workforce as well, because the health workforce is aging, they are migrating, at the edge of burnout. So we need to shift some of the tasks of health workforce to machines, artificial intelligence. With Dr. Murashko, under the auspices of Prime Minister Mishustin, we will organize a European conference on artificial intelligence and digital health before the end of the year. And some of the tasks we need to shift to the people by increasing health literacy. Mental health is the next one. Mental health needs to be at the center of our society to create resilience. We have now a generation of children who is afraid that their parents will die, their grandparents will die. They are told not to hug them. They have different vocabulary. 1 out of 2 of the youth is prone for depression and anxiety. WHO will triple its effort on mental health. And finally, what we need is vibrant societies. We need societies which are resilient to non-communicable diseases and pandemics. And their digital health can play a very important role, and the healthcare workers. But, my friends, let us remind what I just told at the press briefing. We are still not out of the pandemic. I'm also optimist, but we still have variants like the B1617 going very fast. So speed is our best friend. We should not let down the guard. 1 year ago, many countries thought the pandemic was finished, and they saw an upsurge. We need to triple the effort globally and in Europe on vaccination. When it is your turn, take the vaccine like I myself did 2 weeks ago. Спасибо вам большое.
Спасибо, Hans.
Thank you very much, Hans. Let's look at successful regional practices in combating the pandemic. Russia is rated number 6 country in the world according to the number of COVID patients, and just 56 place for the number of deaths per 100,000 of deaths. Since the pandemic is still on, we can describe our situation in Russia as controlled and stable. So this is a great contribution of the state healthcare system. So, Mr. Murashko, the question is, what were the measures that allowed you to start getting out of the pandemic, and what could be other tools to further improve the situation? Thank you very much. We have prepared some slides in order to answer the questions and share some of the data that we can provide. During one of the sessions today, Henri Kluge said that had the COVID been more contagious, how would the situation then unfold? However, I think localization of this infection would have been much more accelerated. This new coronavirus infection can be described as just being medium contagious, with just medium lethality and severity of the course. And this is evolving to become a pathogen that can further stimulate the pandemic. This is how we see COVID, new coronavirus infection, as we view it as a pathogen that found itself in this very niche. The higher, contagious viruses are localized in a faster way, with a shorter localization period. As to how we could act in response to this situation, British counterparts spoke about 3+1 major criteria to be met. So I would agree with that. So all the countries are acting in the overall paradigm. So knowledge and operative level of management and good understanding of what it is that is happening. So it is important to collect data about those who are sick with it, or hospitalized, or information about the medical resources and drugs. This information should be accumulated continuously, almost 24/7 online. It has to be further structured into several cohorts, and it has to come from the first-hand sources. So otherwise we will have an increased variability, lack of accuracy. As soon as we have intermediary stages, point A transfers information to point B, then to point C, and further on, then there are unavoidable distortions that we're facing. And when information is uniform, it comes from one point to all other sources, it can be relied upon. In this structure, we need to have the incident management scheme which is a tool to manage an incident, which we had here in Russia. Stop Coronavirus was a uniform information system, and the two-document rule was introduced, so the guidelines for treatment and the resolution on delivery of medical care. Everything should be clear and intuitive. The mobilization of hospital bed fund. An important lesson that we learned was that just the hospital beds might have two functions. The labor delivery beds can be turned into infectious, and gastroenterological department beds could also be transformed into COVID. However, there was not only beds; it had to be supported by medical personnel that would be trained to ensure individual safety and security, and using personal protection equipment. We had certain prerequisites there in Russia. It took about 3 to 4 weeks to train over 1.5 million medical workers. This system becomes available and accessible to create a uniform approach. Adaptability of regulatory documents and acting legislation. Together with our counterparts from STADA, we discussed the stress situations in a situation of the medications deficit, how we could best adapt, and how important it is to have a certain reserve of sustainability. We also need to engage with volunteers more actively. Non-medical personnel proved to be as critical as medical, and this engaging with non-medical personnel to deliver medical health is important. It doesn't mean that volunteers would provide treatment to the patients. Please don't please get me right in that it is important to more efficiently distribute the roles and functions among different types of personnel. Another principle is the unifying approaches to prevention and treatment, and this relies upon the principle of two documents. You can't change the reference number or the title of the document. It has to cut through the whole process, but it can be fine-tuned to include more recent information and data. We have one name and surname almost throughout our whole life. I'm not excluding marriage situations when we change our name. So we have a certain identity concept of ourselves. But if we go across our ages and analyze how we felt ourselves at different age groups, but it's would be kind of sustaining, but it will be 4-0, 16-0, or whatever progression in our self-perception. And it'll also provide a great number of people with an opportunity to feel themselves part of a uniform paradigm. So the first speaker said that it is important to set the definitions right. So this paradigm in which you have to exist and work is an important thing to define. Financial sustainability and funding is important. we started reforming financial approaches, and I think it was something that we had to do urgently. Today, the mandatory medical insurance fund, like an icebreaker, proceeds to create further the single billing system and a single quality assurance system. Another block is fast-track R&D works, and up to the scaling stage, while providing high quality of the end product. When we introduced new medications into the new civil procedures, each of the box and packages was marked, and we were approached by people who said, didn't you have enough on your mind? You started reforming the marking system. People worked 24/7 and also were engaged in innovative effort and modification effort for certain processes. But had it not been done then, it could have proved lethal. Through this marking, you understand where this box is, who it went to. Then you can trace how efficient it proved during a certain treatment. And there were, if you have uniform parameters for treatment, all the hospitals and medical institutions should be receiving this medication and use it accordingly. When a woman knows where the sugar basin is and how much sugar is still there, she would be a very efficient housekeeper. We have quality control laboratories for medications, and I could, in other words, say which reagent is on which shelf and how much it is still remaining in this particular vessel. So digitalization is necessary, not because it simplifies this procedure. Computerization and digitalization does not make our life easier, it just makes it more efficient and transparent. Another thing is I started off with it was the need to create a uniform single databases to inform the population.
So all the information that appears during training or treatment is all entered there. And yet another block is data that's used in training artificial intelligence. Machine vision and programs and machine learning that were very important when a large number of photographs needed to be processed. I wouldn't call it a stress test. I would rather describe it as a kick down, that is when you press your gas pedal to the full, push it into the floor to see if your car really responds the way you expected it to. And we did that to our healthcare system. We tested it for operating to the full. Dr. Kluge talked about mental health as well. That's one of the parameters that needs to be taken into consideration. It's a multi-factor model. You can't exhaust it with any one parameter. So that's what we do. We look at sets of parameters together, and we look at all the different mechanisms involved. That'll be it. Excuse me for maybe making myself not very intelligible. Thank you very much. You're always so clear and so methodologically transparent. I think it gives a very clear picture of where Russian and world's healthcare systems are going, and they should be going. My next question is for Ambassador Venkatesh Varma, His Excellency, Ambassador of India to Russia. The COVID situation in India is one of the most serious in the world right now. Are you able to reformat your health system right now, or is that in fact a task that you are setting yourself? And what measures are you taking as you do this work today? Thank you very much. I'll continue in English.
Almost 1.5 years into the COVID-19 pandemic. And it has shown two lessons, the nature of the virus. That anticipating its spread has not been easy. We are still not very clear on its origins. And adaptation has been absolutely critical. You're right that in the last 2 months, India has gone through a very difficult period. In February, we had 10,000 cases. In April, we had 400,000 cases. So the spread of the virus was quite unprecedented. India was not the only country where this happened. It has happened in other parts of the world as well. But in each case, the spread and its virulence didn't follow the same pattern. So the virus needs to be tracked almost continuously. There is no complacency in not following the virus in its various forms. The second aspect is that you have to follow the virus in terms of data, real-time data, and how to use it in real-time measures. A number of countries have learned the lesson of how do you combine preventive measures along with economic lockdown. And I think it has generally been understood that the sort of measures that countries took last year cannot be easily repeated again and again. So the second factor. Third factor is that you have to use technology to the fullest. And digital technology has now, there's been a revolution within digital technology and health combination because of the virus. And India has been amongst the forefront of using digital technologies both for monitoring and for treatment and now for vaccination. And the numbers are very large. Thirdly, your internal resources are not always at the same place where you need them. India has never been short of oxygen. We have a lot of oxygen capacity in India, but all that was concentrated in the eastern part of India. So in April, when we had this huge spike in the numbers of COVID patients, we had to transport oxygen across several thousand kilometers. We had an annual requirement of 5,000 odd metric tons of oxygen. The oxygen requirement shot up to almost 9,000 tons, 10,000 tons, almost doubled within a span of 2-3. Having said this, I think quick adaptation, public information, and public health measures which can accommodate the maximum number of people, I think has been critical. Fortunately today, the numbers in India are much less. The positive trend is continuing. If we had 400,000 cases in April, now we are doing 150,000 cases. Still very high, but far more manageable in terms of the health infrastructure that has been hugely ramped up. Our testing infrastructure has been also greatly increased. With regard to national measures, of course, it is axiomatic that no nation can deal with it itself. International cooperation has been absolutely critical. And India has followed this right from the beginning. We have attached the highest importance to the WHO. Last year, we were in the forefront of sharing hydroxychloroquine when it was needed at that point of time, and paracetamol, including to Russia. Earlier this year, we stretched out and offered the initial doses of vaccine production that came up in India to over 60-odd countries. And even today, international cooperation, I think, is absolutely critical to fighting the pandemic. National measures are indispensable, but we need to combine it with international cooperation, and the two go hand in hand. And this, I think, is an excellent example of we come to what has happened between India and Russia. Russia, too, has stood by us in our time of great pain and sorrow, and we thank the Russian government. There was a telephone conversation between President Putin and Prime Minister Modi. Russia has given us humanitarian assistance in very great numbers, very quickly, and we are deeply appreciative of the assistance that Russia has provided. And I'd like to take the opportunity of the presence of the Minister Murashko here to convey a very warm gratitude for the support that India has received. Sputnik vaccine is the first international vaccine that has been registered in India. Now we have 3 vaccines. Russia has already provided more than 3 million doses of vaccine. So as we move up and increase our vaccine production rate in India, by August, Sputnik will be one of the 3 very major vaccines that will be deployed. India has already vaccinated 220 million people. The rate is increasing. And if we are to increase the rate, we need all the major vaccines. And India will be an open house for all the international vaccines that are there. We are in touch with AstraZeneca and Covaxin, which is an Indian vaccine, has already been registered. Sputnik is coming in a very major way. We are in touch with Johnson & Johnson. And as we go forward, we see this as the way to move ahead. Finally, when the production full capacities are used, 60 to 70% of Sputnik V vaccine that is produced anywhere in the world will be out of India. So once the Indian and Russian requirements are met, Sputnik vaccine will also be available for our international partners. Sputnik Light is also being under consideration in India, and we hope that once the regulatory approvals are taken, Sputnik Light will also be added to the list of vaccines that we move forward. The scale of the virus and its spread and its impact is so much that there is scope for cooperation with all. And we're very glad that Russia has emerged as one of our main health partners. Lastly, I would like to mention that regulatory approvals nationally are important. Everyone has had to adapt. Normal vaccine approvals took several years, but in this emergency situation, this was done in a manner that provided public health and public good. At the WHO, let us recall the central importance of WHO to the international public health architecture. Let us all lend our strength and our support to strengthening it, to see the indispensable organization that it is. India and South Africa have put forward a proposal for easing of IPR regulations with respect to vaccines. We are glad that it is slowly attracting more and more international support. The BRICS has played an important role in lending support to this. We also welcome the more positive approach that has been taken by the United States government. These are all good trends that we hope that will help not just India, but countries elsewhere in the world to face the great challenge, the public health challenge that has been posed by the COVID-19. Lastly, let me say, as a resident ambassador in Moscow, let me thank Minister Murashko for the excellent support that the Russian Health Ministry, Russian hospitals in Moscow have given not just to diplomats who have fallen ill, and not just from India, but my colleagues tell me that is the case from others as well, and Indian nationals who have fallen ill during the COVID pandemic. The Russian health system has reached out and has treated them with the same care that that they have treated their own nationals, and we are very, very grateful for that help. Thank you so much.
Спасибо.
Thank you very much. His Excellency gave me a great idea for introducing the next speaker. International cooperation is critical in critical situations. The Russian-German Chamber of Commerce is very actively involved in engaging businesses in joint activities, not just at the times of the coronavirus, but at all times. We observe an explosive growth of involvement and commitment. The Chamber received 72% more applications for membership last year than they did 2 or 3 years before that. And they started a digital platform. They launched it very quickly. Let me introduce Matthias Schepp, chairman of the German-Russian Chamber of Commerce, head of the German business delegation to Russia. I have a question for you, Mr. Schepp. Do you think businesses have a role to play in increasing the resilience of healthcare systems? And if you believe it has that role, then what can business do in such difficult times as this? Thank you very much. Let me begin by expressing my thanks to Russia for its successful treatment of the COVID situation. I myself fell victim to that disease. 80% of my lungs were affected, and the doctors did something absolutely heroic. During the first few days, I was an anonymous patient. They didn't know my name. And the government very quickly did three things. The Russian government. One was a balanced and very reasonable lockdown, in Moscow at least. Secondly, stepping up the number of hospital beds available for COVID patients, in large cities at least. And thirdly, purchasing medicines that can save lives during the cytokine storm, the worst phase of the disease. Now, let me turn to your question about how our businesses can help in crisis situations, what they can do. In fighting the pandemic, business, whether Russian or international, has demonstrated how well they can act to be crisis resilience. The Russian government decided not to close down all industries in a lockdown. Factories continued to work. But, ladies and gentlemen, let me tell you, a good manager, German or Russian or American or Indian, doesn't matter, a manager who knows how to organize the correct processes in a factory with 500 workers or 3,000 workers. So such a manager can organize work in such a way that social distances and temperature checks and testing can be put in place, or persuading people to get vaccinations.
Russia was a country which produced very fast 3 very efficient vaccines, which was another great achievement that was demonstrated. If we were to look at our German business, it also adapted quite fast to new emerging challenges. By our express surveys of businessmen in Germany, we can say that there were record-breaking investments made into Russian economy. According to the Bundesbank data, only during the first 3 months of the year. So if we were to compare inflow and outflow of the capital, we invested 1,100,000 millions of euro, and we are now carrying out a survey among our businesses currently, and over half of companies want to hire more personnel. That signals of their trust in the development of our Russian market, and they don't want to see people laid off during the pandemic. Another 40% during the year to come plans to increase their investment. If we very carefully study our business surveys, you will see that we always ask which spheres of the Russian economy you would describe as the most promising in the years to come. So the Russian healthcare system was rated as number 7 or number 8. Now it is rated as number 3 by 37% of respondents. They say that they expect quite a good growth in this sphere. Only the agriculture and IT, telecom and digitalization areas are a little bit lagging behind. Hence, both Russian-based and German businesses can rely upon the investment to come. Businesses proved quite adaptable during the pandemic. As a society, as policy makers and economy developers, we are taking good advantage of what this scholarly findings show us. I became the member of the board of the Chamber of Commerce, but before I worked as a journalist back in the 1990s in Russia, then in China, and then in the USA. So my greatest success was when back in 2003, I was the first to discover that SARS-1, when the Chinese government claimed it came from Hong Kong, I made a discovery that it came from the south of China. And this is a funny story indeed. So then our German scientists just came to Beijing to communicate with me and the Chinese counterparts. So the Chinese authorities gave them just some parts of the SARS-1 in a lead container. And in a very famous hotel. The worker put it into the minibar. I said, Rolf, my dear, give me this virus container. I have a big refrigerator. And when the SARS-2 attacked, I was already knowledgeable about coronaviruses, and it took me very little time to understand just good news and bad news about it. This SARS-2, which is COVID-19. What's good about it? It's less. It entails less mortality. However, it is quite contagious and spreads quite fast. So our scholars gave us a vaccine in a shortest period of time. So we need to follow suit and get vaccinated as fast as we can. In Germany, we are champions of organizing vaccination procedures. However, there was a lack of vaccines for a long time. However, now we are progressing quite successfully, and our population is prepared and ready to get vaccinated, while in Russia, population is not very eager to get vaccinated. I have 100 employees, and once a month I use a carrot and stick strategy to talk them into vaccinating. 85% of my staff members either have antibodies because they had already been sick with coronavirus or got vaccinated. Many countries demonstrated some COVID chauvinism. The virus will not ask whether you're an American or a Russian person. We need to coordinate and work together. We have a representative of the World Health Organization. It would be very good if we had one single document in the world that will enable us to travel across borders, that will demonstrate whether the person has antibodies. Then, if you have antibodies, you are freer. You're free to travel. If you have, no matter whether you have developed these antibodies after you've been vaccinated by Sputnik or Pfizer or any other vaccine, it would be good if we moved along these lines. Thank you. Thank you, Matthias. I think that your staff members, the ones that have no bodies, still looking at you, they trust in medicine and they know that their lives will be saved at any rate. For a health system, it is very important to rely upon human capital. So we see how the healthcare systems get transformed. We are moving along personalization of treatment over more efficient systems of health care delivery to our patients, and it is important to ensure a certain coordination between medicine and other spheres to increase the quality of life of our patients. So my next question is to Guzel Ulumbekova, head of High School of Healthcare Organization and Management. Guzel, what conditions would we need to increase the resilience and sustainability of the healthcare systems, and can the improvement of these systems affect the national goals delivery by 2030? Thank you, Elena. In our department, we start off with the goals, and the goals were set up by our president, and then we departing from the goal, we will distribute the tasks between the departments. The president of Russia, Vladimir Putin, set 3 major goals in terms of the quality of life of the Russian people. First, it's an increase of the real income of the population. The second is increasing the birth rate. And the third is decreasing morbidity rate and increasing the life expectancy. Life expectancy is calculated by the age-related death rate. So if death rates goes down in the young age, then life expectancy is on the pickup. So we would like to increase the life expectancy up to 75 years by 2030. All the set goals look quite feasible. How can the improvement of the healthcare system, how can it positively affect all these goals? So the increase of the real income of the population. By the way, all the three goals are interdependent and interconnected. So the increase in the real income of population, and this is the responsibility of the economic bloc. I've been attending economic sessions the whole day. They're working on their proposals still. So far, the real incomes of our population are going down by 3.5% for last year, and it puts an additional stress and increases the role of medical workers' services and healthcare system to provide the free of charge health services. Increasing birth rate. We need to have healthy males and healthy females that would have healthy posterity. We can affect this goal. However, there is another thing. People should be aware of what it is that awaits them in the future, and that they should be sure that they will have enough money to survive and live. So then the third block, reducing the death rate. So the High School of Healthcare Organization and Management has calculated and analyzed the factors that affect the death rate dynamic. So each country has its own dynamic. Life expectancy is affected by real income of the population. It accounts for 40%. It's another question to the economic bloc. The role of the healthcare system and its funding is 50% important factor, and the healthy lifestyles is another 50%. It's an interdepartmental and cross-sectoral goal to pursue. In order to bring down the death rate, the major balance for the healthcare system, and WHO will just confirm my words, the major balance between the inflow of patients and the stability of the healthcare system. Healthcare system capacity should be able to meet the needs of the growing flow of patients, which is growing. There's both chronic and acute forms of COVID-19. These are the patients that fail to receive due medical care for last year. Hence, we need to invest in our capacity building and funding. So how do we need to fund our healthcare system? We discussed it yesterday the whole day, and today no one proves any statistics. So at least 5% of the GDP have to be channeled for funding of the healthcare system. So now we have 3.5% funding, and we're doing quite good. Whether we're, but we're 1.5% short of target. So economic bloc has to channel 3.5% of GDP to us.
I talked to the financial people and to the Council of the Federation, and they keep saying, well, we care about people's health. But look at the sort of budget they adopted. The healthcare budget is actually reduced between the year 20 and the year 22. You see, healthcare is rather like defense. It looks after the people, and we should be treated accordingly. We save lives. Who else saves lives? Armies. The army of doctors, the army of nurses, the army of paramedics. Yes, indeed, we have programs to support the medical services, but the goals there are mostly infrastructural, not the people involved. And the armies can suffer from burnout. They're tired. In America, for instance, 1 in 3 medics are ready to retire because they are burnt out. The figures are pretty much the same in Russia. So what are we to do about that? Well, if we have any more financing, we can direct it towards countering that. It's 7 trillion rubles a year added to the figures for the previous year. That's what we want to get. So that's what you do for your army of doctors. The second thing an army needs is the weaponry, the ammunition. Our ammunitions are medicines and drugs. No one gives you figures, but I can. We made the calculations. We need to triple the market of medicines. Why so much? Because if we compare ourselves, for instance, to Poland, to take just one country, the share of GDP devoted to free healthcare in Poland is 3 times that of Russia's proportionally. So we need at least that much. The next thing an army needs, on top of personnel and ammunition, is the command system or management. It needs to be centralized, headed by the Federal Health Ministry. Can you imagine in the Ministry of Defense each kind of the armed forces reporting directly to the president, but not their defense minister? That wouldn't do, nor would it do in the health sphere. Now, every health system is resource limited. When resources are limited, what's needed is standards and quotas, and we need a centralized management system. The simplest model that would work is a model based on budgets, not based on competition. Even our American colleagues who believe in competition generally today are prepared to say that they need budget-financed healthcare in small localities, for instance. This is the way we should go as well. So more financing, money to pay for more people in the industry and for more medicines, and a centralized system of government. So if our finance people don't know where to take that money from, we can tell them. They can put to great use some of the gold and hard currency reserves, or dig into the fund for national well-being. Oh, Guzel, you're such a passionate person. Certainly, you're right. But we must not forget one more thing that can be critical to success of healthcare systems. It's technologies, its digitalization. We could not even dream of having a new drug on the market within just a year or two. But look what happened to vaccines this year. All the necessary processes were accelerated, and new anti-COVID drugs are now quickly available. We'll now talk to Asgar Rangoonwala, Managing Director for Emerging Markets of Johnson & Johnson. He's a hero. He was a person who stayed online waiting for his turn to speak here for all this time. Now, let's ask him how his company, Philips, can manage to act successfully in times of the pandemic. You represent a leading corporation in the pharmaceutical sphere. What, in your view, is the role of innovation when it comes to resilient healthcare systems?
Elena, and it's a great pleasure and honor to be with you. I hope you can hear me well. Look, it's a great discussion to have, right? And it's interesting that this virus helped us all together to think differently about healthcare system. So, in fact, I would love to be in St. Petersburg, but today I'm still in Beijing. So I have been all the time here in China, and I could feel and also experience firsthand what kind of change in, I think, societies around the world, and especially in China in the very beginning, this pandemic had, right? Look, it was, I think we all learned a big lesson that health and well-being of the mankind is a critical element. I think nobody can value health more than after the pandemic. I think the entire world is very much in favor of having a more robust, more forward-looking healthcare system. And I think all societies in the world asking their government now, what are you going to do in order to prevent these kind of pandemics first, but also how can you further increase health and my health, especially because everybody looks for himself in the first beginning. So look, I think first let me emphasize the value of innovation. And of course, pharmaceutical innovation is a critical element, not only pharmaceutical, but also innovation in the entire healthcare system. I think we heard many times today how relevant data generation is, how relevant it is to have also access to innovation, but especially pharmaceutical innovation in the last couple of years brought a big deal of additional life expectancy. Guzel, you talked about that is also a kind of strategic goal for the Russian government. And, in fact, if you look into the data, pharmaceutical innovation brought 1/3 of the additional life expectancy what the world enjoyed in the last couple of years. So I think it's very important, not only from the healthcare point of view, but also from the economic point of view. I think we heard today earlier from the WHO how relevant healthcare, better healthcare and better access to innovation is even also for the economy. So from the socio-economic perspective, better healthcare, better access to innovation in healthcare is critical. The question is now access to healthcare. Look, it was fascinating to see last year around that time when we had a close, pretty much lockdown here in China, how fast the China government accelerated regulatory approvals. So that means I think the China government, as the first experienced government in terms of the pandemic, realized very, very fast they cannot stop to put new products into the Chinese market. And I'm also very thrilled to hear from my team in Russia, similar happened in Russia. So it's not only that the vaccine got accelerated in terms of access, but also many other products, life-saving and life-changing products found their way into the different healthcare systems from emerging market to developed market. I think everybody understood very well we cannot stop to provide better medicines to people. But regulatory approval is one thing. Reimbursement and access to patients is another thing. Look, I think around the world, there's always a discussion about funding and who pays basically the bill for healthcare. I think, Guzel, you mentioned that just a few minutes ago. It's critical not to save money in healthcare because that's an economic driver and also very relevant for the societies. Talking about funding, looking at the market, which is a sizable market, of course, this could be always larger, but around 0.8% of the volume and 17% of the value of that particular market is devoted to innovative products. This is far below what we see in other markets, but it's still a good trend because in the last couple of years, the Russian government increased dramatically their efforts to provide better access to innovative products, which are normally life-saving and life-changing, and more to come, I guess. I think just last year, the announcement of this Circle of Kindness is a breakthrough to provide better medicine to orphan indications, to children especially. So that's a great movement, more to come. If you about the future, I think it's very relevant to have a sizable, not only investment, also focus on access to innovation from regulatory perspective, but of course also from patient access and reimbursement perspective. And this brings me to the last point. It's not only pharmaceutical products. I think the whole entire healthcare ecosystem is pretty much under discussion in these days. We heard a lot about digital healthcare. We heard a lot about outpatient. I think that's all critical because we have seen the pandemic has disrupted to a large extent patient pathways. So what we have seen around the world, not only in the emerging market, but also in the developed market, is that patients, especially in pandemic situation, did not find their way back into the healthcare system. And still they are not back. So for chronic and critical diseases like cancer, like immunological disorders, patients just disrupt their treatment, and especially what we see in mental health. Earlier today, I think Hans talked about the acceleration of mental health issues driven by the pandemic, but also in general, I think mental health patients in these kind of situations really had problems to continue their treatment or would not even don't get access to any kind of treatment. So I think it's all our responsibility from the industry, of course, from the governments, from all the players in the healthcare system to think and to work hard to provide broader and better access. This could be digital solution. This could be outpatient solutions, could be home care solution. There are a lot of digital and also other innovative elements actually under development, but it's always important to have an active dialogue like this to discuss what else can we do, especially for mental health patients after the pandemic. The data showing that 24% of the population claim themselves to have emotional distress and also are depressed. That's an alarming signal and also a call for action for every single government. So hopefully I can join you next time in person, and it's really a pleasure to be with you. Thank you so much.
Спасибо. Спасибо, Асгар. Он не только герой, что остался.
Thank you very much, Asgar. You are just a real hero because you stayed over with us, and just you're a very tactful person. He represents the Johnson & Johnson company, and my great apologies. And I would like to turn the floor over to Peter Goldschmidt, who is the executive director of STADA. And my question is about international cooperation. In your view, how efficient international cooperation is and how it can affect the sustainability and resilience of the healthcare systems, and what measures could we take and could prove most efficient to combat the crisis?
Appreciate it. So if you look at pharmaceutical production during the COVID crisis, there is one general observation, and this is that more or less not many factory has closed during the crisis. So meaning people working in production, pharmaceutical production factories across the world more or less stayed open. So if you take the case of STADA, our company, we had worldwide 21 factories. We only closed, based on government advice, one factory in China for 2 weeks. Otherwise, we produced the whole time. So thinking about now the supply chain of pharmaceutical goods in the overall global perspective, you can say production in the end was not the issue. So the world could sustain the production. What was the issue partly and is partly today, and we see it also with the COVID vaccine, is now the distribution or equal distribution across countries. And we have observed, of course, in crisis time, if you have needs as a country where you have patients sick, of course you think first about your country. So it was obvious that we will see some kind of protectionism, and we have seen it really in the goods flow. And you have to see that pharmaceutical supply chain is not as straightforward as others potentially. So until a product comes to a patient, it might have been in 2, 3, 4, sometimes cases even 5 different factories, because you have different ingredients, you have packaging, you have finished goods. So it's not so easy, and it's really a global process. So what I think is really the solution here, and what is very important also for the future, is not to support local protectionism. I think we need to find ways and agreements to keep free trade during crisis time, because in general, we had enough products. It's just like how we distribute it. And I think that's really the agreement. It's very hard to prepare for something like COVID. I would say nearly impossible. But what you can set up is the framework of how you want to interact, how you want to have a flow of goods, and how you really want to act in situations like this. So I think that's really key. But there's one other point which is really close to my heart, and I want to address this as well. So obviously, if you have a situation like COVID or any crisis, what do you do first? You want to treat someone who is sick. So you focus on what is the treatment for COVID. You need to have enough treatment, and you need to have enough hospital beds and so on. So that's a learning in itself. So what do you need to do in crises like this to provide enough? But it's difficult because no one knows really how the trials look like. The second thing, and you rightly mentioned it, what went extremely well was the development of a vaccine. In record time, normally it takes 3 to 4 or 5 years to develop a vaccine and get a vaccine approved, but it was spectacular what really happened in Russia or in UK or in the US, in Germany, how vaccines were developed. So I think that was really well done if you look at the world healthcare community. But now is one important thing which I think we don't have really on the radar screen, and this is, in a crisis like this, if you have to act and focus on certain things, what's happening is you have unintended consequences. And you know, one of the biggest unintended consequences is really, what really makes me sad is, if you look at the overall healthcare market, you might think, hey, they must have been growing the last 12 months, people need more medicine, they do more self-medication, they take vitamins. I can tell you, most markets have decreased strongly. If you look at Europe in the first 4 months, Europe healthcare markets are down minus 12%. So what do you think is the reason? I can tell you what the reason is. The reason is that because we did the right thing of focusing, treating COVID patients in the hospital, because we focused on distances and less people in the doctor's office, less people were treated on other diseases. We have dramatic declines in treatment of oncology patients, on chronic patients overall. We have countries like, for example, the UK, where oncology treatments are down 20%. So stress testing national healthcare system is also about to anticipate as fast as possible, not what to do in terms of treating the cause of a crisis, but also what to do for every others. And even other elements like what was mentioned before, the burnouts, mental issues, and other areas which really have affected. And I really want to support what was said before in terms of how can we conquer this. Yes, we can conquer it systematically, but I think in the end, self-responsibility, education is absolutely key. Yes, it takes money, but I think on the other hand, we have now really way more ways in order to push that. So for example, you mentioned it on India. If I look at telemedicine, if I look at what people are trying to search on the internet, it's booming big time. There are really opportunities and actually pretty cheap in order to create education and also get overall opportunities. The other element here is that we also should focus on protection and self-care. So I think it's really important that we also educate much more of what people can do themselves. So if you think about COVID, vitamin D, vitamin K, to have a strong immune system, to be healthy and fit has really helped. So that's all playing into the favor of driving individual responsibility. So I would say that's it from my side, and appreciate really the invitation and the opportunity to give some considerations.
Спасибо. Спасибо, Peter. Спасибо.
Thank you very much, Peter. Thank you. Dear colleagues, when Mikhail Albertovich gave us such a detailed account of how the healthcare system works to ensure the sustainability and resilience, I noticed that one of the efficient tools that he mentioned was a system of quality assurance and management in medical care delivery. And I would like to turn the floor over to Roskачество, which is quality control agency, Yulia Mikhailova, so that when summing up the discussion outcomes of today, we could once again look at an important thing. How can a state impact and promote the establishment of such resilient and sustainable systems as healthcare systems by quality management and risk management? Thank you very much. I'll be rather standing so that I don't, so that I could face both the panelists and the members of the audience. All the issues we discussed are very important. However, there are several mechanisms in order to establish sustainable and resilient systems, be it in the economy or elsewhere. And one of them, which is an effective one, it's a system of diagnosing of business processes construction inside this or that system. And I'm very confident that we need to rely upon the principle that we hear while flying in planes. First, put the protective mask on yourself and then on your child. And it takes some time to realize why is it so. You won't be able to help the one who needs your assistance and help if you are not able to protect yourself, if you're not equipped fully to render this assistance yourself. My point is, and I would like to share my sincere admiration and gratitude to the Ministry of Healthcare of Russia and all other institutions and Mikhail Albertovich personally for building up a very clear system-level quality system and management in the health area when opening the forum on the World Day of Quality Management. You said a very important thing. So it is with the minimal losses that we lived through a very tough 2020, basing on the organizations that already had this quality management system in place. So they would be proactively doing it. So I really appreciate your input and your stamina. It was difficult to survive, and we could have forgotten about diagnosing. However, we didn't do this. The system of public health care is the first for is number one in filing self-diagnosing applications, and it is rated as number two in our economy industry in the number of laureates and certificate holders in the quality assurance paradigm. So in 2020, you were also very actively involved in quality control, and I hope it's going to persist in the future. And thank you once again very much for your effort. Our session is driving to a close. I would like to thank all our panelists who were here with us quite late in the evening and gave us such a detailed account of what has been done to improve the resilience and sustainability of the healthcare systems. Thank you all for your stamina, for your attention and your will, and I hope you live in a non-stressful life.